Welcome to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist based out of Oklahoma City with a license to see people in almost all 50 states now. This week, we're doing something different on the podcast. I hosted an AMA or Ask Me Anything about a month ago where I allowed people to send me questions on social media that I would answer on a Zoom call. I got a lot of really amazing questions, and I answered them on a Zoom call where hundreds of people were there or registered to do the Zoom call. And I thought I should share this with my podcast listeners because I thought the questions were really good and I thought the answers were pretty good as well. We talked about thyroid disorder, gut health, and hormones. And so I'm going to share that with you. Some of the questions that I addressed were, what is Hashimoto's and what are your thoughts on symptoms and treatment? What do you consider optimal numbers for TSH, free T4, free T3, reverse T3, TPO? What are potential reasons a TSH would be elevated, but all other thyroid labs would be optimal? And what would you do about this? After that, we kind of transitioned into gut health questions, and I answered things like, what are symptoms of SIBO and what is SIBO? How do you know if you have leaky gut? How do you really fix leaky gut? I talked about how modern endocrines approach to leaky gut and our analysis of gut health and what we do, how I feel it's better than what other people do. Because somebody asked, I've done this several times. I've dealt with leaky gut before. It didn't really work. So how is your program different or better? We talked about a gut connection with poor iron. So when you have low iron, it can actually be a gut issue or an absorption issue and what to do about that. And then I transitioned into talking about hormones. I had some interesting hormone questions, one of which was about estrogen replacement 18 years post-menopause. Is it safe? Can you do it? Does it help vaginal dryness? What are the risks? What are the benefits? We talked about bioidentical testosterone in women. What are the risks of that? What are the benefits? Is it possible to just take testosterone if you don't need estrogen and progesterone? And we talked about optimal testosterone levels for men. So let me know if you like this type of podcast. Reach out to me and let me know on social or here in the reviews, because I may continue to do more of these, but I hope that you enjoy listening to these answers and this webinar as much as I enjoyed recording it. So the first question is, what is Hashimoto's and what are your thoughts on symptoms and treatment? So this is a really good question. I picked this because I think Hashimoto's is a big buzzword right now. And there's a lot of people who are like, well, what is it? What are the symptoms? And so Hashimoto's is a type of hypothyroidism, meaning that your thyroid is not working well. So it's not making enough thyroid hormone. So it's a state of hypothyroidism or underperformance. Now, the interesting thing about Hashimoto's is there's a wide variety of Hashimoto's. So you can have Hashimoto's, but not necessarily need or be on thyroid medication. You can have Hashimoto's and be overtly hypothyroid and need medication. But when I think about hypothyroidism, what I think about is this is an autoimmune condition. Your body is attacking yourself. In Hashimoto's, it's attacking your thyroid gland. So for whatever reason, your body has started to attack your thyroid gland. And when it does that, your thyroid gland can't do what it's supposed to do, which is make thyroid hormone. So imagine, your thyroid being attacked by all these outside invaders. It becomes very inflamed. So then when your brain gives the signal to your thyroid to make thyroid hormone, it can't do that because it has all this inflammation and all these bad things in it. It's not able to perform its function of making your thyroid hormone. So the way you know you have Hashimoto's is by checking an antibody level in your blood. The most common one is called a TPO or thyroid peroxidase antibody. It's a blood test. And typically on labs, that number should be less than 9. The lower, the better. But if your level is elevated, some labs, the reference range goes all the way to 32 or 34. If it's elevated, it will show that, hey, you have this elevated antibody. And that means that your body is attacking your thyroid and causing all this inflammation. And so what we know is that over time, if you don't make that antibody go down, your thyroid will eventually stop working because it can't make thyroid hormone with all that noise and all that inflammation. So Hashimoto's is that elevated TPO antibody or thyroglobulin antibody, TG antibody, just a blood test saying, yes, something is attacking your thyroid. But at Modern Endocrine, and what I like to do is tell you why. Like, why is this happening? Because I was diagnosed with Graves in medical school, which is the opposite. It's overactive. And then after I was treated for Graves, I developed Hashimoto's. And my question was, why? Why is my body attacking my thyroid? And what do I do to make it stop? A lot of doctors just give you thyroid medication, which you can take all the different types of thyroid medication to replace the thyroid hormone that your thyroid should be making. But if you want to know why that's happening and try to make it stop, then you have to dig deeper. And so that's where gut health is highly impactful. But so are other hormones like insulin and just regular hormones, your sleep, your nutrition, different things like that. So that's where I really got very passionate about gut health and hormones because of my own personal journey of why do I have a high TPO antibody? And mine was in the hundreds. It was very high. It's now undetectable, which I'm very happy to say, and I'm not on medication. And that took a lot of time. But Hashimoto's is just your body attacking itself. The symptoms that you can get from Hashimoto's are any symptom of thyroid disease, right? And so that is a very huge range of symptoms. And I think this is why it gets missed a lot. It can just be fatigue. It can be cold hands and feet. It can be irregular menstrual periods, which I see is missed a lot. We blame irregular menstrual periods on stress or weight gain or whatever, but it can be from Hashimoto's. It can be joint pain. It can be abdominal pain, bloating, discomfort, because you have a lot of stuff going on in your GI tract, which is what's causing your Hashimoto's. And we'll kind of talk about that when we talk about leaky gut. So the treatment of Hashimoto's, or, well, back to the symptoms, it can be diarrhea, or I'm sorry, it can be constipation. It can be weight gain. You can be cold. Your hair can come out. So anything that you think about with hypothyroidism, very similar with Hashimoto's. I would say one of top 3 symptoms with Hashimoto's I see is fatigue, like debilitating fatigue. People are so tired. They get pretty constipated. And a lot of them have skin issues, whether it be like rashes, their hair's falling out, something like that, in addition to abdominal discomfort. So bloating, gas, diarrhea. The treatment for Hashimoto's, the quick win treatment, is thyroid medication if you need it, right? So give somebody back the hormone their body needs that it's so desperately trying to make in that inflamed state. So you give someone thyroid medication for a quick win. That is not the ultimate overall treatment, though. The ultimate overall treatment for Hashimoto's is to figure out why someone has Hashimoto's and then fix that. So what you want to do is you want to tell them, why are you inflamed, right? So why are you inflamed? What can we do to make that go away? What can we do to make your body stop attacking your thyroid? And so what I look at in this state, we kind of have a 10-step to ultimate health at Modern Endocrine. I look at, are your mitochondria inflamed? How is your gut health? What does your nutrition look like? Are we moving every day? Are we seeing the sun? What does our sleep look like? What does our mental health look like? Are our relationships good? Things like that. In addition to, what we know. And so we really dive into trying to help you figure out what's causing the inflammation. And a lot of times it is your gut or your insulin level, which can be driven again by external stresses in your life, sleep, etc. But I think to truly treat Hashimoto's, I know because I was a patient, you have to look at the whole picture and you have to figure out what's causing that inflammation. And in me, it was insulin, it was my gut, it was my stress, it was my sleep. I'm in medical school, I'm not sleeping, I'm super stressed. I was eating whatever I could find to eat. I had leaky gut, I had SIBO, and I had PCOS and high insulin. And so once I got a hold of all those things, my antibody levels started coming down. And then that's how I treated my Hashimoto's. So it was kind of a long-winded answer, but Hashimoto's is very dear to my heart. So the next question is, what are symptoms of SIBO? And this is a great question as well. So for those of you listening who don't know, SIBO is small intestinal bacterial overgrowth. And it's kind of become a buzzword in the functional medicine space and with gut health, right? And so what it means is that you have bacteria, and they're not always necessarily bad bacteria. They're just bacteria in the wrong place. So you have a lot of bacteria in your small bowel that shouldn't be there. And they cause a lot of different GI symptoms. So these are the people who have abdominal distension, they have bloating, they have diarrhea and or constipation. They can have joint pain. They can have fatigue, weight gain. Some people have nausea and vomiting. So there, again, it's kind of like Hashimoto's where you have a lot of different symptoms. But if you're having, any sort of GI symptoms. I tell people this all the time. Like, you shouldn't walk around with acid reflux every day. You should not wake up and have a flat stomach and go to bed and look like you're pregnant. You shouldn't have a lot of pain or distension in your abdomen. You should have at least one bowel movement every day that comes out very easily. And when you wipe, there's not a lot of stuff on the tissue and you're not like pushing or straining to get it out. Like, these are normal bowel habits. If you don't have that and you have pain when you eat and your stomach is distended and you have gas, these are problems. And so you could very well have SIBO. And the way you know whether you have SIBO, besides just symptoms, is testing. And so we do GI maps at Modern Endocrine, but there are different tests that you can do to see if you have this small intestinal bacterial overgrowth. And then depending on what other things you have going on in your gut, you develop a treatment plan to fix it. We use a lot of supplementation and dietary things, but we also have an app where we don't make them, we encourage them to go through this app. And it's a 4-month process where I teach you something every day about your gut. So I teach you, how does sunlight affect your gut? How does stress affect your gut? How does fiber affect your gut? And so just giving you these foundational things to help you learn about your gut and help you fix SIBO, yeast overgrowth, whatever you have. So I really like that question as well, because I know a lot of people struggle with this, and thankfully it's becoming more known in the space. So the next question is, how do you know if you have leaky gut and how do you really fix it? There are so many people on social media that talk about it, but they are always trying to sell some sort of drink that you have to, or that make you pay for a plan. And so that's a very valid question. So how do you know if you have leaky gut? So again, testing is the gold standard, right? So if you do a GI map or whatever stool test that you do, there is a marker called zonulin, and you measure that marker. Zonulin is a protein that holds our cells together. So our GI tract is lined with cells, so very, very tightly together like this, right? There's a protein between there that holds our cells together, kind of like a fence, like nails in a fence, or if you think about like barbed wire, but it's really close. Zonulin is what holds that together. As you develop leaky gut, these cells start to break apart and zonulin leaves. So it's broken off, and you can test that in stool or in your blood. So if you have high levels of zonulin, that shows that the cells of your GI tract have broken apart and it's become leaky. And so that's how you know if you have leaky gut. Now, I can usually tell if people have leaky gut by their symptoms, and it's the ones we were talking about, right? Your stomach is distended throughout the day. You have abdominal pain, discomfort when you eat. You're bloated, all of those things. If you have an autoimmune disease, so like Hashimoto's, Crohn's, rheumatoid arthritis, a lot of times those autoimmune diseases and the attack on your body is actually coming from leaky gut. So anytime I have someone with an autoimmune disease, I'm very on high alert about, okay, do they have a leaky gut? I start questioning them a lot about their stomach and their stools and their GI health. And they're always like, why are you asking me this? Because I'm trying to determine whether your leaky gut is what caused your autoimmune disease. So the way you fix leaky gut is you have to go in and repair that damage to the lining. So if you think about like a wall, if somebody just goes and punches holes in a wall everywhere, right? Then you're going to have issues. That's kind of what happens with leaky gut. So you have to go in and you have to repair that lining of the gut so that when you do eat food, it's not leaking out of your gut into your bloodstream. Because when food leaks out of your gut and into your bloodstream, that's where we get a lot of inflammation. About 70 to 80% of our immune system lives around our gut. And so if we have all these holes in our gut, every time we eat, food is leaving our gut and getting into our bloodstream. And our immune system is freaking out because it doesn't know what red dye 40 is, and it doesn't know what glyphosate is, and it doesn't know what all these ultra processed sugars are. And so it thinks your body's being attacked every time you eat. And your immune system revs up, your cortisol increases, your insulin increases, all these things happen, and your body's on high alert every time you eat. So the way that you fix leaky gut is to fix that lining. But just fixing the lining doesn't always help it. So the reason I like stool studies is because I want to know what else is going on. Like, do you have bad bacteria that we need to remove? Do we need to add good bacteria? Do you need digestion support? Do you need acid? Is your immune system completely shot? Do we need to give you back some good immune guys to help you fight this? And so you can't really just fix leaky gut by itself because something caused it, right? So if we go in and we repair those holes that have been punched in the wall in a house, but we leave the person there punching the holes, they're just going to make more holes. Same thing with leaky gut. And so it is very important that you work with somebody who understands that and can get a big picture of your gut and tell you all the different things that are going on and then come up with a plan to fix it. So selling you some sort of drink probably is not a good idea, but giving you a comprehensive plan, I mean, that is how you fix leaky gut. It is almost impossible to fix leaky gut just by saying like, oh, I have leaky gut, let me, take some supplements, because even if you clean up your diet, if you have an overgrowth of certain bacteria that need to leave, you're not going to know that without testing. And so, again, you need a plan, because if you have bad guys there causing the issue, they're going to keep causing the issue until you remove them. So, your gut is a very intricate, system. And so, knowing everything that's going on, and then digestion affects those bacteria, and digestion affects how your food is actually absorbed, and it affects leaky gut as well. So it is a process, and it can seem overwhelming and probably frustrating to people. I know that sometimes my patients are like, oh my gosh, that's so much information. But I do think that when you have gut health issues and you are working with somebody to fix them, a plan is the best way to go, because if you don't do a plan and you don't follow something for 3 to 4 months, the chance of you succeeding is very low, because there's so many different things that we're working on. First, we have to kill the bad bacteria. Then we have to make sure you're digesting your food correctly. Then we make sure that your immune system's good. Then we start fixing all those holes. It doesn't make sense to fix the holes before we get rid of the bad guys. And I do think that community is a good thing, and walking through a plan and having somebody there to help walk you through it is also a good idea. Sometimes when we start something, if we don't have a plan and a long-term solution, we don't end up following through with it. So again, kind of a long answer, but that is my take on leaky gut and people trying to sell you things as well. What makes our program better than any of the other 5 or more that you've listened to? It seems no different than a skincare seller. Sometimes there's too much data to analyze. I want what's best for me, not the norm. How do you define that? And what makes your analysis or approach different and better? And I think this is a very fair question too. So when we do stool studies at Modern Endocrine, we do spend an hour with you going over it. So my health coach is so amazing. She has such good training in nutrition and gut, lots of things. I actually review every one of our stool studies. I come up with a plan. She makes sure that you understand that plan and you understand how to incorporate that plan into your life so that you are successful. So what I would say is different with our program. Yes, you're going to get a lot of data, but you need data in order to know how to fix it. So we're going to make sure you get the data and you understand the data. Then we're also going to make sure that we give you a plan that's tailored for you. So we don't have just a plan that we give people at Modern Endocrine. I literally review all the studies and I come up with a treatment protocol for everyone. And then Sarah, my health coach, will talk to you. And if you can't do that protocol because of the timing of the supplements or the type of food, then we tailor that plan to you. So we make sure that you have a plan that you can follow. And we also make sure that we educate you and we hold your hand. So we have this app, again, that gives you training every single day. And it is very basic information. And then it gets more complex as we go, because I take for granted the fact that I know what a processed food is and I know how much fiber you need and I know what fiber does to your gut and all these things, but a lot of people don't know that. So our plan is meant to educate you so that you have all the tools that you need so that you never have to do this again. And you know how to not only fix your gut personally, your gut based on your study and what's going on in your life, but you also then have the tools to keep your gut healthy long term. And we do have a Facebook group that's private where you have a community and you can, reach out if you have questions. We have a portal. So I think that our program is just special because we try to make it very personalized to you. We meet you where you are. We will do whatever we can to make sure that you are successful and we follow through on it. And we also have something where every day you're getting good educational information that you need to make sure that this change stays lifelong. So it's something that you're going to fix and you're not going to have to keep refixing. The other thing that I would say that's a little bit different in our approach is if you want to work with us as a patient too and not just do gut health, Modern Endocrine's approach to healthcare is phenomenal. Like we literally start at your mitochondrial level. Like, are your mitochondria in your cells working? Are your cell membranes working? Are they even able to accept the hormones that you're taking? If not, then we fix them. We look at your gut, we look at your nutrition, we look at, your movement, your exercise, so all the things I told you, sunlight, relationships, and we do a very in-depth hormone analysis and blood tests too. And I also pride ourselves on the fact that we're like detection people. So I don't want you coming to me in 5 years from now and having a heart attack. Like, I have tests that I can run, like true diagnostic tests, and I can tell you, what is your age, what organ systems are working at what way, what is the most likely way that you're going to start having issues from what organ system. Do we need to look at more advanced screening like PET scans or additional testing, because are you at higher risk of developing cancer? Like, I mean, there's so many things that you can look at now in medicine. And so we are able to customize a plan as detailed as you want, or as not detailed as you want, but we really like to look at hormones as a whole. So we are different in the fact that I'm looking at all of your hormones. I'm looking at your insulin and your cortisol and your, melatonin and leptin and how they all work together, which is why I wrote the book that I did, that's coming out later this year, is just to educate you on how all these things work together too, and how you can take all of this information and apply it to your life and be healthy for the rest of your life. So I think that's where we're a little different. This person had their gallbladder removed at age 21, and now they have chronic GERD or acid reflux. And so they're asking, what can they do, especially when they're pregnant? So this is a really good question. I think that removing your gallbladder is one of those things, unfortunately, that people get kind of thrown into this surgery, and surgeons never tell you, like, oh, after you've removed this, there may be issues. Your gallbladder is actually important. So let's talk about what our gallbladder does. It helps us digest fat, which is very important because we're going to eat fat. We need fat, especially as women. We need fat for our cell membranes. We need it for hormone health. We need it for brain health. Your gallbladder also is very important from an aspect of, it makes something when it produces the enzymes and the bile that it makes. It's actually helping protect you from bacteria. So it's actually helping prevent you from getting bacterial overgrowth and things like that. So when somebody takes your gallbladder out, it's not just, oh, now you're not going to digest fat as well. It's also now, hey, I might not have the right bacterial balance when I eat. And so a lot of times when people have their gallbladder removed, they will end up with acid reflux because they are not digesting their food the same. In this person in particular, they're probably not digesting fat very well. And so when you don't digest fat very well, it will set. Sometimes you get diarrhea. Sometimes you get acid reflux. And then they may have a bacterial overgrowth because now they don't have that bacterial static component of their bile acid every time they eat. And so it's just making a misbalance of how the bacteria throughout their GI tract are flowing. So we have a supplement at Modern Endocrine called the Dissolver. It is for people that don't have a gallbladder or people who have high steatocrit levels on a GI map, meaning you're not digesting fat well. One of the things that is in our dissolver is ox bile. Ox bile is very important if you don't have a gallbladder because it will help you digest fat. And so in this person in particular, I would recommend you need to take something with ox bile. The dissolver is a great one. You take it about 15 minutes before meals, and especially if they're fatty. Otherwise, every time you eat fat, it's going to be really hard for you to digest it. And I'm assuming this person is a female because they said especially when they're pregnant. And you need fat as a female. You need it for your hormones. You need it for your brain. You need it for your baby. And so sometimes it'll get even worse when you're pregnant because you're maybe eating a little bit more fat. Now, when you're pregnant, there's a lot of changing in your abdomen, right? And so the physics of your abdomen are different. So that pressure from the baby is going to kind of push up on your stomach. And so that's going to make acid reflux worse as well. That's why some people get acid reflux later in pregnancy. But that acid reflux that you're getting could also be not only from the fat, the issue with digesting fat, but also the issue with the abnormal bacteria that you have now that you don't have the ox bile, or now that you don't have the bile acids from your gallbladder. We have another supplement called Gastric Acid Pro as well that helps a lot with heartburn. If you're pregnant, that is a little more difficult. I would say during pregnancy, if you're struggling with heartburn, a lot of that would be dietary, like looking at dietary triggers, but you can take ox bile when you're pregnant. And I would to make sure that you're digesting fat well. We do have a guide on our website that's free. We have a lot of dietary guides, but we have one about H. pylori in particular, and you could download that guide and it will walk you through foods to stay away from if you're having a lot of heartburn type symptoms, but a lot of citrus things, chocolate, caffeine are going to upset that. So I hope that was helpful. The next question is, I had breast cancer and thyroid cancer in 2009, told to stay away from all phytoestrogen foods. I want to know if this theory still holds. Adding estrogen replacement 18 years post-menopause seems impractical, but is there anything besides average lubricants that can be helpful for vaginal dryness? So this is kind of a twofold question. So the phytoestrogens, there's a lot of different research right now about phytoestrogens. I think in moderation, they are just fine. I don't feel like people eat a ton of them other than soy, but I do feel like in moderation, they're okay, especially if you have a good detox system. So your liver's working and you're pooping every day. If you're having a hard time with bowel movements or liver detoxification, then you definitely want to be more cognitive of these types of foods. But again, I think in moderation, all of that is fine. Also, if you've had breast cancer and you're listening to this, you need to know how you metabolize estrogen. There are different pathways. There's an alpha and a beta pathway. If you've had breast cancer, you definitely want to make sure that your estrogens aren't metabolizing down the alpha pathway. The alpha is awful. It causes breast cancer. And so there's a blood test called estrone that you can check. And if your estrone levels are high, then there are things you can take to supplement to help kind of push the conversion of estrogen. One of them is DIM. Calcium D-glucuronidase helps if you're somebody who is having problems metabolizing estrogen from your gut. And these are things that you can tell from testing like Dutch testing and gut testing. So there are ways that you can kind of mitigate that. As far as adding estrogen replacement 18 years post-menopause, I'm so glad this was brought up. The WHI came out in 2001 and kind of blew up hormones in women. So the Women's Health Initiative said you should use the smallest amount of hormone for the least amount of time because theoretically there was this increased risk of cancer. That study has been relooked at multiple times in the last 24 years. There's been meta-analysis that have come out and said, we really got that wrong. None of that literature holds up. And if you're practicing medicine today and you're actually reading literature, you know that none of that is true. Estrogen is phenomenal. I don't care how old you are. You can start it at any point. It is so good for your bones. It is good for your brain. So it'll keep your bones strong. It helps with blood flow to your brain. So it's going to help decrease your risk of dementia. It helps with skin, right? So dry skin. It helps with lubrication. So if you're having dry eyes and a dry mouth, dry vagina, any of that, it's the lack of estrogen. Now, testosterone will help with that vaginal lubrication to some degree, but so will estrogen. Now, I do know that this person mentioned they had breast cancer. And so that's a whole nother story. Can you take estrogen after breast cancer? And there's a lot of literature now that supports that you can, as long as it is a bioidentical form, as long as those levels are being monitored, as long as you're working with somebody who understands how to do that. And so at Modern Endocrine, what we do is we do give women estrogen after breast cancer after we have a risk and benefit discussion if we feel like that will help them. And in this person, it very well may. If vaginal dryness is bothering them, we monitor how they digest estrogen. So we do Dutch testing. We make sure their estrogen levels aren't high, things like that. So if you did not have breast cancer, 100% adding estrogen, even 18 years out, assuming you don't have seizures are the only true contraindication to estrogen, would be just fine, even 18 years out, even 30 years out. I don't care. If you've had breast cancer, there needs to be a little bit more of a discussion. But still, if you're having symptoms, that is something that could help you and will not only help with the vaginal dryness, but other things as well. Your bones, your brain, your skin, your heart, etc. Estrogen is very protective of heart in women as well. That's why we don't develop heart disease until we get much older and lose our estrogen, because it's so protective of our heart. So I hope that was helpful as well. If a woman has low testosterone but sufficient estrogen and progesterone, is it possible to just be prescribed bioidentical testosterone? 100% yes, it is. And so I think this is becoming a little more mainstream. You see people talking about testosterone in women now. Unfortunately, the FDA, there is no clear guideline on well, first of all, there's no FDA approved treatment for testosterone in women, which is crazy. I joke that men obviously make those guidelines, but there's no FDA indication. Yes, you can take testosterone. I give testosterone to hundreds of women. There's different ways you can take it. I do think it's advantageous without estrogen. Women start to lose testosterone in their 30s. By the age of 40, women have typically lost more than half of their testosterone. And that's part of the reason that when we hit 40, ladies, we just feel like we fall apart. Our progesterone's going away. We don't have testosterone. And we're like, oh my gosh, we're hot. We can't sleep. We start gaining weight. Our mood is crazy. And we're like, what is going on? Testosterone is that one of those hormones that is very beneficial for your sleep. It's kind of like a calming hormone. It helps with anxiety tremendously. So I see a ton of women in their early 40s who are super anxious. They have low testosterone. Some of it has to do with their gut, but testosterone is powerful for anxiety as well. So to answer your question, yes, you 100% can take testosterone, even though your estrogen and your progesterone are normal. And then my question would be to you, if you're interested, is why is your testosterone low? So you can go down that pathway. And sometimes it's from your adrenal gland. So as a woman, we make most of our testosterone in our ovaries, actually. We make estrogen, but we make testosterone, but we make a lot of it in our adrenal gland. And so if we are very stressed, we have adrenal fatigue, we're chronically stressed, whatever, then our adrenal gland is going to be making cortisol and it won't make testosterone. And so my question always to women is like, well, why is our testosterone low? Is our estrogen, or I'm sorry, is our insulin high? Is our cortisol high? Like, what is going on? So just something to think about too. Is it in your gut? In my book, I talk a whole chapter about like testosterone in your gut, estrogen in your gut, progesterone in your gut, and explain to you why all those things are really important. But yes, 100%, I've taken testosterone for several years and have adequate estrogen and progesterone levels. So it also helps women, by the way, with our muscle mass, maintaining muscle mass. It's harder for us as we get older to maintain our muscle mass. And so testosterone will benefit your muscle mass. It does help with blood flow to your brain. There have been studies that show that adequate testosterone in women lowers our risk of dementia by about 8 times. Testosterone helps with, again, anxiety. It does help with sleep. It will help with some lubrication, vaginal lubrication, and it helps with libido. So all good things. Is there a gut connection to poor iron or other absorption? So basically, this person's asking, like, if you have low iron, could it be an issue with your gut? And so that's a really good question. And the answer to that is 100% yes. So I see this a lot in our clinic. If you're our patient, we check ferritin levels on everyone. It's important for your immune system. It's important for your thyroid. If you have really low iron levels and you also have really low vitamin D and B12 and folic acid, iodine, things like that, I really start to worry about your gut. Like, obviously, we're maybe not absorbing nutrients, especially in somebody who's not restricting their eating, right? So if you're not like strict vegan, typically in America, we have access, thankfully, to enough food and nutrient rich food that like you shouldn't have a bunch of vitamin deficiencies. Now, with iron in particular, what we worry about, especially in women, is like, are you bleeding excessively from menstrual cycles? And that's what's causing your iron to be lower. And that happens a lot of times too. But if that's the case, then we want to know why. Like, why are your periods so heavy and miserable? Because you shouldn't have extremely painful, heavy periods. Like, your menstrual cycle is supposed to come, you bleed, and it goes. It's not supposed to be this terrible, like, can't get out of bed issue. And so if you are having that, it tells me there's an imbalance in something in your hormones. And so like that needs to be addressed as well. So looking at your iron, yes, there can be a connection to your gut. It can be leaky gut. The other huge one I see though is H. pylori. So when I see somebody who has really low iron levels and they're having acid reflux, almost 100% of the time when we do a gut study, they have H. pylori. And sometimes people even, like, I saw a lady the other day who I knew she had H. pylori because her iron, her ferritin was so low. She's actually not even having heavy menstrual periods. She has terrible acid reflux. She had an EGD. She saw a GI doctor and had a scope like 2 months ago. And they did one biopsy and they said, oh, you don't have H. pylori. It's one biopsy in one little piece of her stomach. When she did her stool analysis, she had extremely high levels of H. pylori, digestive issues, all sorts of things. But in her, that iron level it's not going to come up until we fix the H. pylori. And your iron level, your ferritin level is very important for your thyroid. If your ferritin is not 70, then your thyroid can't work. So Free T3, which is our active thyroid hormone, in order to be like taken into a cell and used, so in order to go into the cell and actually work, you need ferritin to help kind of pull it in there. And so when your levels are really low, your thyroid hormone can't work. And there's been studies that show when your ferritin is less than 20, it's actually detrimental to your heart. So it is very important and it is tied to your gut, and it can be leaky gut absorption issues, but very commonly seen with H. pylori. So potential reasons a TSH would be elevated, but all other thyroid levels are optimal levels. And what would you do? So this is a good question too. And this may have come from a provider. I get this question a lot from providers. TSH levels take a really long time to change. So keep this in mind. Your TSH is a signal from your pituitary in your brain. It is like a good average of what's been going on for like 6 to 8 weeks. Your free T3 and free T4, which I'm assuming are the other thyroid levels that they're talking about that are optimal, those change within days. So if you have somebody who has thyroid dysfunction and you've tried to fix it recently by medication, by lifestyle, by low dose naltrexone, which we didn't talk about with Hashimoto's, love low dose naltrexone, you can have normalizing free T3 and free T4 levels, but still have a high TSH, meaning your TSH just hasn't like caught up and realized that everything is good. So that's one time that it happens, right? So maybe we're treating the thyroid, things are getting better, and we just haven't had enough time for that TSH to shift and change. Another very common thing that I see though is iodine deficiency. So iodine has been, more in the news recently, and people talk about it on social media, whatever. So if you have a significant iodine deficiency, because a lot of people don't eat salt now, because supposedly salt makes your blood pressure high, which, side note, sugar makes your blood pressure high. I don't think it's salt, but if you're not eating enough iodine and you're iodine deficient, and then you see something on Instagram or Facebook or whatever, and you're like, oh, I'm going to start taking iodine, or I'm going to, start eating a bunch of seaweed or whatever to get your iodine for your thyroid health. If you have a massive influx of iodine really quickly into your body and you're iodine deficient, it actually will shoot your TSH level high. Your free T3 and free T4 will be completely normal. Your TSH can get really high. I've seen them like 20, 30 with completely normal free T3 and free T4 levels. The patient has no symptoms. I get referrals for this sometimes. I got one from a cardiologist once. It's like an 80-year-old guy and his TSH was 40 and his free T3 and free T4 were completely fine. And he was like, I don't know why I'm here. I feel fine. His wife had heard that iodine was good for him and so was giving him a massive amount of iodine for like 3 weeks before that. He was iodine deficient. His TSH came back down to normal in about 4 to 6 weeks. So you can see that as well in iodine deficiency. Your TSH will go up and then it will come down. And the reason that happens is because there are transporters, SIN transporters, that require, like when we replace iodine, it causes our brain to make TSH. So it is a cellular mechanism and how that happens. So those would be the two common reasons. One is that your TSH just hasn't come down yet, but you are treating your thyroid correctly. And the other one is iodine deficiency. So that's a good question. What is the optimal testosterone for a male? So this question is a little more difficult because it's going to depend on the age of the patient, right? So this is where I get on a soapbox about normal. If you look at a normal lab range on a test, like a Quest panel, DLO, whatever reference range you use, for men, it will typically say that testosterone is normal from like 270 to 1100. That is a huge range, y'all. So like, is 270 normal or is 1100? Like, that's insane. And so I see people all the time who come to me and they're like, well, my testosterone's normal. It's 360. That's not normal in a 30-year-old. So it's very dependent on your age. I also am very particular in testosterone. So I like to look at free testosterone and I like to look at sex hormone binding globulins, because sex hormone binding globulin is a protein that's made in your liver. If you have a really high sex hormone binding globulin, it binds up your testosterone and then your testosterone cannot work. So your testosterone level that is quote unquote normal is going to be dependent on that sex hormone binding globulin as well. So if your sex hormone binding globulin is high, you actually need even more of a total testosterone level because you need more available for the cell to actually be able to use it. So when we're talking about total testosterone, I like to see in men, 20, 30, 40-year-olds, I like to see you close to 1,000. Like you should be close to 1,000. You'll feel well, you'll feel optimized. Now, that being said, I'm looking at your free level too. I like you to be about 120 to 140. Like those are very good optimized testosterone levels. That being said, I'm also making sure that your sex hormone binding globulin is normal. If it's not normal and it's high, you may get men who have a testosterone of 1,000 and have a free testosterone of 120, and they're like, I don't feel well. I feel like I have low testosterone. Well, that's because even though their testosterone's 1,000, half of it is bound up by that high sex hormone binding globulin, and it's not circulating or able to be utilized by the cells. So they really kind of do have a testosterone deficiency. So it's important to look at all of it, and it's important to work with somebody who understands that. But ideally, I like to see testosterone around 1,000. I'm okay with 1,100 in people as long as they're not having bad side effects. And we know from a functional cardiac standpoint that they're in good health as well, right? They don't have sleep apnea. They don't have, high lipoprotein A, cardiovascular issues, super insulin resistant, things like that. Although optimizing someone's testosterone helps with that. When you get into your later 40s and 50s, I think a testosterone of 900 is adequate. Early 40s, maybe closer to 1,000, but 900. 60s, 800, they usually fill well. 70s, again, I don't really like people to be less than 700. 600, 700, I feel like that's where they feel really good. And from a free perspective, even, 100, I like you to be 100 or higher, even in your 60s and 70s. Now, again, I don't want you having bad side effects. And so if we're optimizing everything and we're optimizing your liver, your detox pathways, your gut, you're not going to have bad side effects with those numbers. But optimal levels of testosterone are going to be higher. They are going to depend on how inflamed you are, what else is going on, and what your sex hormone binding globulin level is. Because if you are very inflamed from high cortisol, high insulin, that's going to make your sex hormone binding globulin go up, and you're going to need a higher testosterone level, if that makes sense. So that was a great question. What do you consider optimal numbers for the following 4 parts of thyroid function? So I get asked this a lot. And I think we do have a downloadable guide on our website too that talks about some like normal ranges, but I'm going to answer this for you guys. So from a TSH perspective, I like to see 2.0 or less. I will caveat this by saying I kind of don't care what your TSH is. I do in the fact that like it gives me a 1,000-foot picture of what's going on. But am I like tailoring treatment just from that? Not a lot. I'm tailoring treatment based on your symptoms, based on your antibody levels, your T4, your T3, your reverse T3, because that's what's important. Because again, I mean, this TSH could have been that level for 6 weeks. It doesn't tell me what's really going on right now. It's almost like a hemoglobin A1C with diabetes. Like it gives you this big 90-day ballpark picture, but I have no idea what's going on in the last week by looking at that. Ideally, though, your number is 2 or less. That means that your brain is happy with the thyroid hormone that you have. The lower, the better. Obviously, I don't want it undetectable, but around 0.5 is a really good TSH. Now, your free T4. This is so when your brain makes TSH and it goes to your thyroid and it tells your thyroid to make thyroid hormone, free T4 is what is made from the thyroid about 95% of the time. So free T4 is about 95% of what your thyroid kicks out when TSH is released, and about 4 to 5% is T3. If you really want to get technical, about 3 to 4% is T3, and then there's a little bit of T1 and T2. So free T4 is our most abundant free thyroid hormone. It is important because when it is released into your bloodstream, the point of free T4 is it is available. And then when your body needs T3, which is the active thyroid hormone and what is needed to make you feel well, we have something called deiodinases. They are enzymes that convert T4 into T3 instantly. So it's like when you walk into a room and it's dark and you turn the light on. That's what T4 is to T3. If your body needs that light, it hits the deiodinase. It's supposed to convert T4 to T3, and then it has it for energy. So it is like this form that's floating around waiting to be utilized because T3 is picked up and used really quickly. Okay. We want a free T4 level of about 1.2 to 1.5. That tells me you have adequate levels there, that they're good. Now, when you're pregnant, I definitely want this level closer to like 1.5. And that's because when you're pregnant, your baby cannot make thyroid hormone for 18 weeks. It does not have a working thyroid. It gets all of its thyroid from you through the placenta. And so T4 is very important so that your baby's brain develops and that the baby develops. But we're looking for about 1.2 to 1.5. That tells me that your body has the thyroid hormone floating around that it needs to flip the switch and convert to T3 when it needs it. Okay. Free T3, this is the gold mine. Okay. Like this tells me what active thyroid hormone you have, and it's going to tell me a lot about your symptoms too, and just your overall inflammatory status. Your free T3, low end 3.5. I like it closer to like 4.2, 4.3, 4.4, 4.5. The higher end of the normal reference range. So like whatever your normal reference range is, you want to be on the high end of that because you want all that free hormone available for your cell to take in and use instantly when it needs it, right? You walk into a room, you need light, you want to turn it on. You walk into a room, you want water, you want to be able to turn it on. Whatever your body needs, whether it needs to make energy to digest food, whether it needs to make energy so you can get up and walk somewhere, so you can have energy to sit here and listen to this and not fall asleep, it requires T3. And so we need a lot of it. And so we want it to be on the higher end. And so this is very important when you're looking at thyroid. And a lot of traditional medicine doctors don't know this or don't understand this. Reverse T3 is also an important number because when we have free T4 that is made from our thyroid, right? In our body, that deiodinase, that enzyme that converts T4 into T3, there's one that converts free T4 into free T3, and there's one that converts free T4 into reverse T3. And reverse T3 is like it's wasted. It's just wasted energy. Like reverse T3 does not do anything. From a biological, perspective, we need it because it's kind of like a stopgap. So the reason we have free T3 is like, let's say we're being chased by a tiger or, chased by a tiger. When your cortisol goes up and you're very stressed, your body's response to stress is going to be, let's convert all of our T4, free T4 into free T3 so we can run away from this tiger, right? Like all at once, forever. Well, there needs to be a stopgap because you don't want too much free T3 because then you have issues like palpitations, diarrhea, things like that. You can't be running away from a tiger when your heart's beating so fast you can't breathe in, you're pooping your pants. So there is a reason that we have reverse T3, and it's supposed to be this really nice balance in people who have insulin resistance, who have poor sleep, who are on a lot of medications. So one of them is like metformin, birth control, things like that. Those things upregulate the enzyme that makes free T4 turn into reverse T3. So it's like our body is like tricking us. And so a lot of people, if you look at these levels, will have very high reverse T3s and very low free T3s. And that tells me from a cellular perspective, you have a problem. So something's going on from an inflammation standpoint. So that's why I like these numbers. So then I can tell, okay, yes, we do have free T4, but our free T4 is making the wrong T3. It's making reverse T3, or it's making the right T3. And then what I can do with that is I can say, how are you feeling? And if you're feeling great and your free T3 is good, then I know, okay, great. Everything is working from a cellular level. But if your numbers look good and you still have all the symptoms of hypothyroidism, then I know your cell membranes are not working. So although the T3 is there and it's knocking and it's trying to get in the door, it can't open the door and get into the cell because something's wrong with your cell membrane. So that's where we go back to mitochondrial health. And when we talk about what is it, your gut? Is it your insulin? Is it your cortisol? Like what is causing this hormone that is available in your blood to not move into the cell and actually be able to be utilized? And so since we can't check free T3 levels in an actual cell, I think we will be able to in the next 5 to 10 years. That will be life-changing. But since we can't do that, we can only check in the blood, and we don't know whether the hormone is going from the blood into the cell. This kind of helps paint a better picture for you, right? So I know if your free T3 is really high and if your reverse T3 is really high and your free T3 is lower and you have symptoms, I know we're making the wrong stuff. So then the question is why? We go back to why. Are you on a medication? Is your gut inflamed? Do you have insulin resistance? Are you super stressed? Do we have an underlying, disorder that we don't know about? This is why it's so important to see like functional medicine providers, because it all goes back to like root cause and why. So I like to see reverse T3 levels 15 or less, ideally 11 or less. And you guys, I see levels 20, 30, 35, like crazy high levels. And these people are not going to feel good. Your body's wasting all this energy and time making a hormone that doesn't work. And not only does it not work, so you're tired, but you're also expending your hard earned energy to do that. It takes energy, it takes NAD, it takes ATP to convert that T4 into reverse T3. And so you're wasted energy and you're more tired. So these are very important numbers. And then TPO antibody, that's the thyroid peroxidase antibody we were talking about, the Hashimoto's antibody. I like it to be less than 9, the lower the better. And TG antibody, another one for Hashimoto's, less than 1. And again, the lower the better. So I hope that kind of explains that and you understand thyroid levels a little bit more. So I went through quite a few questions and I wanted to try to kind of keep this at about an hour. So I think what I'm going to do is I'm not going to necessarily take any questions right now. What I would love for you to do is if you have them, email them to us, or send them to me on social media. And what I'll do is I'll compile them. And then next time I'm going to pick a few less questions. We'll do a webinar next month. I'll maybe pick like 6 or 7 questions, and then we'll leave 30 minutes for like Q&A questions. And so that you can ask whatever question you want the next time that we do it, because I don't think I'm going to be able to answer very many, to be honest with you. I want to be respectful of your time because I appreciate you being on here tonight with me. I do want you guys to know, I believe that your health starts in your gut. And so if you're struggling with anxiety and brain fog, mood swings, bloating, all the things, you're not imagining things. Your body probably just isn't teed up to work how it's supposed to. And so that's what I really love about us is we're different in the fact that like we want to tell you why you aren't working the way you're supposed to and want to help you really feel better. And so you've got to work with a provider who understands all of that. We have a gut health package that I love. It's very near and dear to my heart. And if you listen to our webinars, you get this special offer. You can buy a gut health program or just a gut health kit on our website. If you go to our website, there's a GI map. You're welcome to purchase it there. If you use this QR code to do it though, when you do the GI map, I'm going to be the one who reviews it with you for about 15 minutes and gives you a big overview of, hey, what's going on? And then my health coach will really get into the weeds with you and explain everything. And so if you're thinking like maybe I am having gut health issues or any of this resonates with you, you have joint pain, you have Hashimoto's, you have infertility issues, your testosterone is low, whatever it is. And you're like, maybe it is my gut. I have nausea, I have vomiting, I have abdominal pain. I'm sick of having GERD. I'm sick of being bloated. I want to get to the root cause. I'm telling you, there's no better way to get to the root cause of what's wrong with you than your gut. I would love for every one of my patients to always do gut studies before they even see us because it's so powerful in fixing everything else. And when my book comes out later this year, I think you guys will understand that. So I just wanted you to know we do have this offer where you can do a gut health study with us. It doesn't matter what state you live in. We actually have a license to practice medicine in 39 states, but gut health stuff we can do in any state, and we're happy to do it virtually. So if you would like to do the comprehensive GI map test, it's that deep dive into your gut microbiome. So I can tell you what is your good bacteria, what is your bad bacteria, what is the balance? Do you have H. pylori? What does the immune system in your gut look like? Do you have inflammation? Do you have blood? Do you have leaky gut? How are you digesting your food? I saw a gut test earlier this week. Just by looking at the gut test, I can tell you this person has some very significant issues with their gut. They need, a colonoscopy, some different things, and could have some pretty significant issues with their health just by looking at their gut, not even talking to the person because their inflammatory markers were so high. They had blood, their calprotectin's high. So just some scary things. So you can do that. You get this 15-minute private consult with me. And if you don't want to do it now, check out our website, look at the information. And if you change your mind, we would love to work with you and look at your gut and try to help you through anything you're going through. And if you don't want to do the gut, if you just want us to look at your hormones, we're happy to do that as well. And so I wanted to offer that to you guys. Just so you know, the GI map to do the test and to get the follow-up visit, which is about an hour with our health coach, the cost of it is $699. It seems like a lot, and it is. That test is very expensive. It's very detailed. Again, tells you yeast, parasites, worms, viruses, a very, very detailed test. And so that test is super expensive, but I think it's worth every penny. I joke with people and I say, you either pay the farmer and the functional medicine doctor now, or you pay the hospital later when you're older. And it's true. Like, you either take care of yourself now, or you're going to be in the system, you're going to be sick, and you're going to be tired and miserable later in life. So that GI map is $699 for the test and to go over the results, but it can be very life-changing. And then if that's not something that you want to do, but you're like, maybe I want to work with them, get some blood work done, we'd be happy to do that too. We're happy to help and serve in any way that we can to make your life and health better, and just to help you figure out the best way to take care of you, because everyone is an N of one. And I tell my patients that all the time. Just because a social media person says, you should do this or you should do that, it has to be taken in context with where you are in your life right now, where you are in your life with your health journey right now, and the chapter that you're at. Because with me, I'm not doing the same things right now that I was doing 5 years ago when I was really sick with Hashimoto's. And I'm not going to be doing the same things next month that I'm doing this month. It just kind of depends on where you are. So if you need somebody to help you guide you through that process, we are so happy to do that too. So I thank you so much for watching tonight and listening to this. I hope it was beneficial in some way to you, and that I answered some of the questions you have. I hope you enjoyed this different type of podcast this week, where I just answered some medical questions and your questions and concerns. If you enjoyed this, make sure that you let me know. Make sure you're following us anywhere you get your podcasts, so that way you get every podcast episode that comes out. I would mean so much to me if you would leave a review, so that way I know that you enjoy what we're doing. Follow me on social media and let me know, reach out to me. I'm going to be asking for questions, AMA questions. Let me know what you want to know the answers to. And I will probably be doing AMAs like this via Zoom about once a month or once every couple months, because I love answering your guys' questions. You challenge me, and you also help others to learn more about, their health and how to be healthier. Besides all of that, besides interacting with me, following me, leaving us a review, please make sure that if you want more information, look at my website. I spent a lot of time making freebies on our website, so www.modernendocrine.com. We have a section called freebies, lots of stuff in there, tons of good stuff about gut health, diet, different things like that. And then I have a section called resources. It's a tab. It has tons of blog posts, podcast episode, lab guides, all sorts of good stuff to help you make sure that your health is maintained, and it's free. Also, remember that Modern Endocrine is now licensed in almost all 50 states. It'll be all 50 by the end of the year, which we're super excited about. So if you would like to become a patient, all that information is available on our website, and we would be honored to help you on your healing journey. Join us next week for the next episode of Hormones, Metabolism, and You. Have a great week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.